Hi Charles, how are you doing today?
I'm doing okay.
Is there another name you prefer to be called by?
Charlie.
Charlie? Okay, that's a nice name, nice nickname. Charlie, my name is Miss Latoya. I'm going to be your social worker while you're here in the hospital, okay? But before I go over anything further in detail, I would just like to kind of go over the confidentiality limits that we have here at the hospital. Whatever you tell me or any of your physicians or nurses here is going to be kept in your patient's file while you're here. And the people that have access to those files are going to be your doctors, your nurses, myself, or anybody that's a part of your clinical team while you're here in the hospital, okay? As well as yourself. You can access any information that's in your file, as well as your parents have rights to know what's in your file as well, since you're a minor.
Okay.
All right, so can you go ahead and tell me some stuff about yourself, like how old are you and what grade you were in?
I'm 15 and I'm coming up on the end of my freshman year.
Okay, so you basically just, since it's the start of the summer, you're just finishing your freshman year. So you're rising, is it sophomore?
Right.
Okay, so what is your preferred language that you like to use? Is it English, or do you use any other type of language?
No, my primary language is just English.
Just English. All right, can you tell me what brought you here to the hospital?
My friends were going off to college, and they were really the only friends I had, and it just triggered some emotions, and so I called my sister, and she said, I said that basically that the world would be a better place without me, and then she called the police, and they came to my house and escorted me to here.
Okay. So you just kind of listened to you. It seemed like you had a lot of emotions just came over you. So your friends were leaving off to college, and can you tell me, when did you meet these friends?
The beginning of my freshman year.
All right, so you were very close to them. All right, and they're going away to college, and so you just kind of felt overwhelmed and called your sister. Can you tell me what all you told your sister that kind of made her worried to notify the police to come to your house?
I told her that our aunt's death was my fault because she was going to get my birthday present, and that's when she had the car accident that killed her. And so I told her that it was all my fault, and I don't really deserve to live anymore, and the world would be a better place without me.
Okay. So it seemed like that's what you kind of told her, what kind of made her feel really worried, that you thought the world would be a better place. Okay, so are you feeling that way right now, currently? All right, can you tell me anything about, do you have any family history of mental illnesses or anything that you know about?
Well, my aunt, she drank a lot of alcohol and she did some drugs, but the doctors really never diagnosed her with any mental illnesses.
Oh, okay. So she had problems with substance abuse and she was in and out of the hospital a couple of times? Okay. What about, do you have any relationship histories that I should know about? Like, do you have a current partner right now? Are you involved with anyone relationship-wise?
No.
Okay. What is your preferred preference? Is it males, females, or both?
Females.
Females, okay. Can you tell me about who's going to be participating in your care while you're here in the hospital?
Well, my two best friends, my sister, and my parents.
Okay. So who do you currently live with right now?
My parents.
So you live with your parents. Who all live in your home?
It's me, my parents, and my sister.
Okay. Do you have, or I know I gathered some information from your parents before, and they mentioned about you had a brother as well. Do he stay in the home with you?
No.
Okay. So where is he?
College.
Okay. Can you tell me about any trauma that you might have had in the past, such as physical or sexual abuse or anything that I should know about?
Up until I was 7, my aunt had molested me, and she was my favorite aunt. That's really it.
Okay. So what made her your favorite aunt?
She would always buy me gifts and stuff.
Okay. So is this your mother's or your father's sister?
It's my mother's sister.
Your mother's sister, so that makes her your maternal aunt. Okay. Do you know if this situation was ever reported to anyone, or?
I reported it to my previous therapist and my parents.
So your parents and your previous therapist, they do know about the situation.
Mm-hmm.
Do you know have anything was done about the situation?
No. Oh, well, she died.
Okay, so she is deceased. So what about now? How do you feel? Do you feel safe in your home or safe at school?
Yeah.
So you haven't had any other issues with sexual or physical abuse in that matter?
No.
All right. Can you tell me what about any alcohol or drug history that you might have?
I used to smoke marijuana and I did some LSD and drink alcohol to try to numb the pain a little.
Okay. What about, have you ever had any problems that came about from participating in these drugs?
Well, one Christmas Eve, I had done some LSD and I was passed out in the snow in the front yard, and they found me and they took me to the hospital, and they found the LSD in my blood, and they let my parents know.
Okay. How did they feel about that?
They were scared and they were disappointed. They wanted me to find some help, so they sent me to get help.
Okay, so you have had treatment in the past.
Mm.
What about, when was the last time you used? Have you used recently?
Yeah, I've still been using it.
You still been using? When was the last time you used?
It was about a week ago.
A week ago? Can you tell me on what type of occasions do you use these drugs on?
Just socially.
Socially?
Mm.
Okay, so whenever you're around your friends, or?
Yeah.
Do you think you're consider your friends like bad influence, or how do your parents feel about your friends?
Well, I mean, my parents, they liked them, really, but like, I don't think that they blamed the drugs on them, more so my emotional history, the way, because in my past I've had some things that happen where just I needed them to kind of ease the pain.
Okay. So are you kind of using the drugs to kind of cope with your feelings at the moment?
Right.
All right. What about caffeine? Do you use any caffeine or?
Yeah, I drink coffee and sodas and tea.
Okay, so kind of like the normal beverages daily.
Mm.
Do you like how many do you consume per day?
Maybe 5, 6.
5, 6. Okay, so like a Coke a day or a cup of coffee or a sweet tea a day.
Right.
Okay. What about nicotine? Do you use nicotine like dip or cigarettes or?
Cigarettes, about a pack a day, got about 10 cigarettes.
10 cigarettes a day? Okay, so are you looking to stop smoking cigarettes? What about drugs or alcohol? Are you looking to stop that as well?
Right, yeah. Yes, ma'am.
Okay, so while you're here in the hospital, hopefully we could kind of help you with that, with managing your substance abuse. Can you tell me more about your self-harming? Like before today, have you ever thought about harming yourself, or do you have any history of like self-harm, like cutting or burning your skin?
No, not the cutting or burning of my skin, but just the suicide.
Okay, so you did just a suicide today. What about hallucinations?
I've been having a lot of flashbacks lately. Like even now, I'm just having flashbacks about my incidents with my aunt and her death and my best friends leaving and everything.
Okay, so you kind of have flashbacks about that. What about, do you feel like in those flashbacks or thoughts, or do you feel paranoid in any way or delusional where they might want to hurt you or?
No.
Oh no, you don't feel that way? Alright, what about mood swings? Have you been having any form of mood swings lately? Have your mood been going up where you're sad 1 minute, happy the next minute, or?
No.
Okay. What about repressed feelings? You mentioned about your aunt. Have you been having repressed feelings where you've been holding anything back about that, or?
Yes.
Yes. Okay. You said something. What kind of feelings are those?
Well, abuse, really, just abuse. That's the only thing I can really think of.
Okay, so you just been having thoughts about the abuse was that when you were a child, right?
Up till I was age 7.
Okay, up to about age 7. So you said, what about sadness? How are you feeling about sadness?
Recently here, with my friends leaving and everything, it's just, I feel a wave of, well, not like a tsunami of emotions just piling on top of me, and it's making me sadder. And that's what kind of made me lead to killing myself. Well, thinking about suicide. It's just how much the sadness is overwhelming.
Okay, so you just been having overwhelming feelings. What about crying? Have you noticed yourself more tearful or with that emotion?
Yeah, I've been crying a lot more lately, and it's been affecting my behavior a little bit. It's making me change.
Oh, okay. You said change. Can you kind of describe one way that you feel that you're changing?
Well, like, I feel like lately I've been feeling a little hopeless and helpless, and it's just, now the change is that it's like, it's getting worse. I feel like with my friends leaving and everything, I feel like there's no one who can help me.
Oh, okay. What about, do you have any history of past hospitalizations, or have you been to a therapist outside of here? I know you mentioned you did disclose something to a therapist earlier. But what about hospitalizations? Have you had any of those visits in the past? To a hospital similar to this one? Can you tell me the age, around what age was that?
Around 7, when the incident with my aunt was occurring.
Okay, so when you were younger, you had a hospital visit. What about after your friend passed away that you told me your friend committed suicide, right? So what kind of treatment did you seek with that?
Just therapy.
Okay, so you saw an individual therapist. Did you do any other form of interventions, or?
It was group. It was like group therapy.
Okay, so you did group therapy as well. All right. So, do you have any fears or anything I should know, like, that is affecting some of your feelings? I know you mentioned that you're with your friends leaving, that you always you just kind of feared that, you just felt sad about that.
Well, I mean, my main fear was that I guess my main fear is being lonely, being alone. Because when my best friend died, I felt alone, and that's what caused me to go to the substances to try to fill the hole. And then I met new friends, and now they're gone. So, and that's what caused suicide, because I was starting to feel alone again.
Okay, so kind of like fear, like people are leaving you.
Yeah.
The fear of abandonment a little bit. What about suicidal? I know you mentioned that a lot. Feeling suicidal. Are you feeling like within the past 6 months, have you felt suicidal besides this current occasion? Okay. So you're currently having these thoughts, right?
Right.
Have you had any past suicidal attempts besides this current occasion?
No.
All right. What about harm to others? Have you felt homicidal to anybody else, where you might want to hurt them?
It was this one incident in school where one of my friends, he got into altercation with this other guy, and they were kind of ganged up on him. So I went in and just blacked out, and I got involved, and then I told them that if they ever touched my friends again, then I would blind them.
Okay, so you got kind of physically aggressive. Was that just to help your friend or save them? But besides that, have you ever had any other incidents where you just kind of blacked out and just harmed anyone else? Or okay, so are you feeling like you would like to kill them right now, or do you feel like you would like to harm anybody right now? Okay. So can you tell me what is the goal that you would like to do while you're here in treatment?
Just want to get some help, relieve the depression, get rid of the suicidal thoughts, and then get back to how I was before anything ever happened, before I lost my aunt and my friend.
you say you just kind of get rid of your depression. So you want to work on manage your depression and your sadness, and as well as your suicidal thoughts. Another recommendation, I remember you said earlier about your substance abuse. You would like to work on that as well, right? Your substance abuse issues. All right. Do you have any questions or anything you would like to ask me before we end our discussion?
No.
All right. Well, Charlie, you'll be seeing me around the hospital. Like, I'll be getting in touch with your parents before the end of the day to kind of set up family sessions and such on, so we could have those before you get discharged. Okay. And we'll work on some individual sessions as well to kind of work on your treatment goals while you're here in the hospital, and kind of discuss anything that your psychiatrist might go over with you while you're here to kind of break it down with medication management or diagnosis. And we'll kind of set up some outpatient supports for you whenever you get discharged.
Okay.
So while you're here in the hospital, I would like for you to kind of participate in all the treatment teams that we have and treatment groups. We'll have activity therapy, we'll have nursing group, we'll have process group, and different kind of groups just to help you find some positive outlets to expressing your feelings and emotions. So I would like for you to participate in those 100%, okay?
Okay.
So if you participate 100%, you get 100% result. I want to see you get a whole lot better.
Okay.
All right. Well, thank you, Charlie.
Never gonna get that time.
At least I can cut that part, huh? Well, cut. Okay. Hopefully, I think it went. That was 17 minutes. Stop.